You know, these summer months can be a time for kids to take a break from school and have some fun. But it's also important to be aware of a decline in mental health. KLBK's Maddie Powers looked into just what happens to students during this time of year.
I have hands-on experience too, not just social work experience.
April Carrasco has been a social worker for over 20 years and has 3 kids of her own. Carrasco says that during the summer, kids are prone to their mental health declining.
So in the school year, you have a schedule where you have to be doing work or you have to be around other kids. A lot of schools don't even allow phones. When summer comes around, you don't have that school schedule anymore. So therefore, there's more isolation, there's more behavioral issues because you don't have the structure.
With kids' schedules now free, many use that time on their phones, tablets, and social media, causing isolation. Carrasco says this really started taking flight when the COVID-19 pandemic hit.
The isolation component and the more mental illness is higher than it's ever been in children because of ever since COVID and the isolation. A lot of these kids haven't come back from that.
And declining mental health can have serious consequences if not taken care of properly.
Suicide rates are on an all-time high. And so we have to take it serious when our kids are sad or depressed. And so don't think it's just something that'll go away with time.
But hope is not lost. Parents can help in many ways.
So parents can help by giving more discipline, more structure to their children. So they recommend just 2 hours a day, quite honestly. That seems outrageous to a lot of people, but it's really not outrageous. It's really important that parents put limit on their kids' social media.
Carrasco advises anyone who is struggling with depression or isolation, do not ignore it and reach out to a professional. If you need help, the Suicide and Crisis Lifeline is always available at 988. Maddie Powers, KLBK News.